Good morning. Welcome to the session on duplication of benefits in the Cdbg-CV program. I'm glad you're here. I'm Diane Schmutzler. I'm a senior CPD specialist. I've been working in the Office of Community Planning and Development in various capacities for the past 15 years, and I'm excited to be talking with you today. I hope you've been finding the conference really helpful. Oh, next slide, by the way. Thank you. Oh, go back one. Apparently there's one missing. Anyway, so we'll cover the introduction. So anyway, I hope you've been finding the conference helpful and that this session is going to be no different than that. For our duplication of benefits this morning, before I jump into housekeeping, go ahead. You can go ahead to the housekeeping slide. That's fine. But for our duplication of benefits this morning, we're going to cover a basic overview of the rules around duplication of benefits. We'll walk through a simple sample calculation, and then we're going to cover what you can do with your policies and procedures to put you in the best position to prevent duplication of benefits in your Cdbg-CV program. And also, hopefully, reduce any stress or intimidation you may experience in the process. I know mentioning duplication of benefits can also often sound a little bit scary and concerning. Hopefully today will help ease some of those worries because that's the goal of this presentation. It's more than just teaching you about what duplication of benefits are and what it means for the Cdbg-CV program. We really want you to leave after this and feel more confident and comfortable in knowing what you need to do and what you can do to prevent any duplication of benefits in your program. And also just realize you don't have to be intimidated by the idea. So first, now we'll go to the housekeeping items. So we'll start. You've probably been through this before. I'm sure many of you, not all of you, have been on these conference sessions throughout this week. But since this is the first session of the 5th day, happy Friday, I'm confident, I'm still confident most of you know what's going on here. So the PowerPoint slides for this presentation should be available at the bottom of your screen amongst that list of many documents there. So if you want to follow along, you can pull those up. There's also a few supplemental documents that I'll be referencing that should be in that list. And in any case, the PowerPoint slides will be available after the presentation if needed. So next slide, please. Your questions, we will answer content-related questions verbally, not in writing, and we'll be doing that throughout the presentation, but feel free to submit your questions throughout the presentations whenever they come up, and I'll do my best to answer them either then or at the end. Next slide, please. There's a chat feature on the slide, and you're welcome to say hello or talk with other participants, and definitely use the chat feature for technical questions. I will not be monitoring the chat, so if you do have questions, please use the Q&A feature for that. Next slide. We are going to have some poll questions in this presentation. You can see them down below at the bottom of the lower down in your screen, and I'm going to try to share the results, but I'll at least mention and give you a verbal explanation of the results. Next slide, please. We are also, this one got left off, we are also using Slido, I believe, if you want to be using that to keep track of the presentation, of the questions for entering your questions and for answering the poll questions. All right. So this is actually where I have poll question number 1, just to get a sense of what your experience is with duplication of benefits. So there we go. Thank you. So we're basically looking to see which kind of category you fit in. Are you pretty confident in your knowledge of DOB? Or are you familiar with DOB, but you still get nervous about handling and preventing possible DOBs? Or maybe you've never even managed DOB, but you know you need to, and you're still a little bit worried about that. Or perhaps this is your first time ever even hearing about duplication of benefits, and you're not even sure where to start. So any of those are fine. Just please select the category that most closely fits your level of experience, and we're going to go from there. Oh, this is great. So a lot of it looks like no one in here quite has actually had experience with DOB yet. So that's great. So this presentation should work really well for you then, because we're going to really walk through the history of DOB, what it is, and what you need to do for your policies and procedures. So thank you for participating. Yeah, it looks like I don't have anybody who's actually I looked at DOB before in practice. All right. So welcome. You're in the right place. Next slide, please. All right. So duplication of benefits. If you have participated in these sessions throughout this week, I'm sure you have heard about duplication of benefits. It comes up very frequently, and it often feels like it's carrying some weight to it. And like it might be something challenging, but it's a pretty simple concept. So we're here to walk you through that and dive deep into that so you can really grasp the important pervasive topic and leave here more comfortable with your ability to recognize and manage possible duplication of benefits for your CDBG-CV program. So what is duplication of benefits? What do we mean when we say DOB? Quite simply, a duplication of benefits occurs when a person, household, business, government, or other entity receives financial assistance from multiple sources for the same purpose or cost. And the total assistance that they've received for that purpose is more than the total need for assistance. So to put it a little bit more simply, a DOB occurs when there's assistance from multiple sources for the same activity, and then that total assistance is greater than the need for the type of assistance. So what we are doing, and when we're talking about DOB, is we're talking about how to prevent duplication of benefits. We don't want more than, you can have more than one funding sources going towards the same activity, but we don't want to have more funds going to that activity than what there is a need for, okay? So the amount of DOB is the amount of assistance in excess of the need. Individuals, businesses, governments, and other entities are all subject to DOB requirements. And it's really that simple. It really is. It's that simple, that straightforward. More funding than what is actually there for the need is a duplication of benefit. So it's your job to address the questions of whether there is more funding for an activity than what's needed, determine what to do about that if that happens, and most importantly, prevent it by setting up your program in a way to help prevent that from occurring. Next slide, please. So in knowing so these are the wrong slides. Is there a technical way of fixing that one?
What would you like to do?
Can I shift to sharing my own screen?
Yes.
And you did a separate presentation on DOB?
I'm not sure how this one made it through. This is an older version.
Well, this is from the regular PowerPoint.
I understand. It must, perhaps I maybe shared the wrong deck.
Which is fine. So you can share you have screen sharing capability. So
Okay.
just go ahead and share your slide.
Great. I just got to figure out how to do that without, one moment. Sorry about that. So I'm just going to cancel that to open the right version. So. This means the other track will also have the wrong set of slides.
This is admin to Diane. I also just sent you my email via our internal chat. If you want to email me the slides, I'll try to
Okay.
get them real quick that way too.
Great. Okay. All right, so I'm going to close that one. All right, so you've got copy. PowerPoint's always very slow. Okay. And then okay, let's see. I've got mine pulled up.
Great. So if you go to presentation mode,
Right.
down at the bottom, there should be a icon that looks kind of like a podium.
I got
We
to.
use that.
Or go to slideshow.
Well, I don't want it to take over my whole screen.
Oh,
Yeah. That's the challenge. Worst comes to worst, we can just make it take over this screen. Will that work for now?
It could, and one suggestion, if you do go to slideshow, I would have you check one setting that might allow you to treat it as a single window.
Okay.
So under setup slideshow,
Yep.
one more to the left, if you, yes, thank you. And if you, on the upper left, you could try browse by an individual window
Okay.
and select that bullet. And then when you go to share, you may be able to pick that where it broadcasts that through the share, and you're still able to see other things.
Yep. There we go. That works. Okay. So can you see a slide that says what is not DOB?
yes, we
Yes, we
do.
can.
Great. Exactly where it should be. Thank you for your help in working on that technical difficulty. Hopefully, I just sent it to the other track as well. So hopefully they have, they're able to resolve that as well. Okay. So we've got through that. I'm getting back to my place. Here we go. Joining back in. So now I'm glad, very glad, Gloria, especially glad that you're here with me to help with the question and answers because I have way too many windows open right now. So thank you all for your patience, and thank you for your assistance in that, and sorry about that error. So here we go. So what is not a DOB? That's what we're talking about. We just talked about what is a DOB, what duplications include, and now we're going to look at the other side of things to get that full picture. It's also because that's also helpful. There is no duplication of benefits when the CDBG-CV funds are used for a different purpose than the other available funding. I do still have a landline, and that's what you're hearing right now. It's an antiquated version, but it serves a purpose. So it's also not a DOB when they're used for the same purpose, but for a different allowable use than other available funding. There's no DOB if the funds are not available to the applicant, and there's no DOB if the funds are from a private loan. And finally, there's no DOB if the funds are from an asset or a line of credit. So let's talk about cash for a second. In general, cash is considered an asset or a line of credit, so there's no DOB. And if there's no specific purpose assigned to the cash, then it's also still not a DOB. And a beneficiary's income, for that matter, is not going to be considered a duplication of benefits. The basic rule here is to look at this from a prudent person perspective based on the cost principles. And we're going to talk about that as we move through the presentation. But just want to give you a quick example, and we'll talk about a similar example later. Let's say a person who lost their job due to COVID receives a gift of $100 from their church, and that $100 has absolutely no assigned purpose or requirement for its use. So in that case, even though they're receiving funding from another source, it has no assigned purpose. It could be for COVID. They could use it for anything. It's a gift. It wouldn't be a DOB with CDBG-CV funding because it's cash and it has that no purpose, no assigned purpose to it. But we're going to use another similar example later that'll show the difference. Let's see. So let's do poll question number 2 here. So which of the following is the duplication of benefits? And I believe you should be able to do this then on the Slido, right? Yep. So this is available on the Slido. And let's see. The question A, CDBG-CV funds are used for a different purpose than another source. The CDBG-CV funds are used for the same purpose, but a different allowable use, such as rent for different months. Would it be the total funds from all sources, including CDBG-CV, is greater than the applicant's need? Or a private loan is used for the same purpose as the CDBG-CV funds? Or an asset or line of credit? Yep. It is available for the same purpose as CDBG-CV funds. So see, what are our results looking like? Looking pretty good. From what I can see is that everybody's selecting, oh, you've got couple going in the wrong answer. So the correct answer here is answer C. It is the only duplication of benefits in this list is that the total funds from all sources, including CDBG-CV, is greater than the applicant's need. That's the duplication of benefits. Some folks selected A. So CDBG-A reads CDBG funds are used for a different purpose than another source. That's not going to be a duplication of benefits because it's funding being used on different purposes for different activities. Okay, so hopefully that's clear. And if it's not, then by the end of the presentation, I hope it will be. So next slide. I don't need to say that anymore because I'm in control. Lovely. So we've covered what duplication of benefit means, but where do these requirements come from? Here on the slide, you can see the list of background source materials for DOB requirements, and these are the resources that you can lean on. We have the Stafford Act, the CDBG-CV CARES Act requirements, CDBG-CV grant agreement with HUD, and OMB cost principles. Now, I want to point out that, shifting this a little bit, I want to point out that while I've included CDBG-DR Federal Register's notice on this slide, which CDBG-DR, if you're not familiar, is CDBG for disaster recovery. The DR stands for disaster recovery. These register notices, CDBG-DR register notice, only apply to disaster recovery. They don't apply to CDBG-CV. However, I'm including them because it's helpful for you to be aware of them, and they provide general directions and materials for duplication of benefit practices. And a lot of times grantees have had experience with CDBG-DR, and you're familiar with those DR notices already. And it's just want to make sure you know that they don't govern CDBG-CV directly. Because there is some overlap, you can still learn from them, but we're not going to review any of the DR references today. So in just a moment. Again. All right, so the Stafford Act, let's dive into some of these background requirements. This was amended in 2019. We're going to talk about that at the end of the session. Pretty much the amendment just addressed how loans were treated in the Stafford Act for DOB. I have the link on here for the Stafford Act. You are free to take a look and read it yourself. It's also attached at the bottom of the presentation and the list of documents. It's actually quite short, so I found it helpful to read it. You don't need to, but it takes a little bit of the intimidation factor away. At least I thought so, because it is so short. So pretty simple and basic. So the Stafford Act states that it requires federal agencies assure that no person, business, concern, or other entity will receive such assistance with respect to any part of such loss as to which he has received financial assistance under any other program or from insurance or any other source. So that's a mouthful right there. But that's basically the short and quick version of that is you can't have more funding provided for an activity than what the need is. Now, the federal government passes this directive on to its grantees. So what's also included is a Dob liability provision. And this provision, and what's important about this, I'm not going to read it off to you, is that it makes the individual liable for duplication of benefits. So HUD doesn't normally use this method of enforcement against the grantee, but it's important for you to know that that provision is in there and that there's some possibility that it could be used in particular by other agencies. So I want you to be aware of it. But the bottom line here that you need to take away is that the grantee is solely responsible for ensuring that actual duplication of benefits does not occur. All right. So now let's look at the CDBG-CV provision in the CARES Act that establishes the requirement to prevent DOB. Here it states that for CDBG-CV grants, the CARES Act provides that the Secretary shall ensure there are adequate procedures in place to prevent any duplication of benefits as required by Section 312 of the Stafford Disaster and Relief Assistance Act as amended, which is what I just read to you, or the one section of it that I read to you. There's only a few more statements in there. Like I said, it's very, very short. So clearly stated, you have to, for CDBG-CV, prevent a duplication of benefits. Now, the resources available for you to help better understand this outside of this presentation and after this for you to study up on, I've got all the links here for you that can help you with this. CDBG-CV guidance is posted at the first one. The second one includes our CDBG-CV TA products on DOB. There's a list of them, quite a number of webinars and other sessions and other resources. Specifically what is there, and that's the third link here, is the CDBG-CV DOB Quick Guide. So you can find that at that link anytime. I've also included that at the bottom of this section for your reference. And finally, the fourth link on here is for the CPD Notice 1706. This is a general reference that was published in 2017, so that predates CDBG-CV, but it explains, and it's not specific to DR, even though it talks about disaster recovery, but it explains how duplication of benefits applies to all of CPD programs when that grantee is carrying out CDBG-DR funding that's specific to a disaster. But in there, I've included just as a resource, as a reference, because it provides a nice overview of how all these programs, all this comes together and what your responsibilities are, and how that applies to other CPD programs. So, and wait, I'm talking about CDBG-DR, and I've talked and I said that they don't apply to CDBG-CV. And I want to point out one more thing for what specifically doesn't apply. So it's true, you don't want to use CDBG-DR notices in place of CV policy guidance. But again, CDBG-DR guidance and notices can be helpful for general understanding of DOB and specifically for guidance on policies and procedures. The main thing you need to know about what makes a difference is that CDBG-DR has a statutory order of assistance that's unique to CDBG-DR. And those provisions often indicate that you have to use FEMA or SBA or Army Corps of Engineer fundings first before you can use HUD funding. There's no order of assistance for CV. So that's the most important thing to remember is that CDBG-CV grantees do not need to follow a statutory order of assistance for delivery like CDBG-DR does. And that's why you really need to be sure you understand that. So if you do look at DR, you're recognize that you don't need to worry about that. So you don't need to validate other funding sources are available before allocating CDBG-CV assistance. And that's pretty much the main element there. So at the end of the day, the main process for preventing duplication of benefits in CDBG-DR and CDBG-CV are the same. It's just DR is more complicated. All right, so now we're going to go to our third poll question. And this says it's a true or false. CDBG-CV, have that up. There we go. CDBG-CV does not require an order of assistance. In other words, you do not have to access all other available assistance prior to receiving CDBG-DV funds. So let's see. We get some more answers in. So far, it's looking like everybody is saying it's true, and that's correct. That's true. It does not require an order of assistance. Oh, we have a couple who are saying it's false. So again, CDBG-CV does not require that order of assistance. You do not, so this is a true statement. You do not have to access all other available assistance prior to receiving CDBG-CV funds. Okay? That's how it's different from the disaster recovery grants. All right, so next, we're going to talk about OMB cost principles and how they reinforce DOB grant requirements. The requirements to prevent DOB are incorporated into your CDBG-CV grant agreement with HUD, and that can be enforced with remedies and sanctions if needed. But since grantees are solely responsible for ensuring that an actual duplication of benefits does not occur, it's important that you include DOB requirements in your agreements with subrecipients and beneficiaries. So in addition, the grant agreements that you have make the OMB cost principles applicable for all grants. And I've included the list of relevant regulations on the slide that make the cost principles regulations at 2 CFR 200 subpart E applicable to the largest of CPD's programs so that you can use those for reference. The cost principles here are another great tool to help you with preventing duplication of benefits and to reinforce your DOB grant requirements. And I'm going to explain how that works. So OMB cost principles on this slide, these provide you with a practical means for determining if a cost is allowable, reasonable, or allocable. The Stafford Act states that a cost allocated to the grant must be necessary and reasonable for the performance of the federal award. So let me take you back to the definition of DOB again. So a DOB means receiving financial assistance from multiple sources for the same purpose, and the total assistance received for that purpose is more than the total need of assistance. Fundamentally, a duplication of benefits is not reasonable, it's not allocable, and it's not allowable. So the fundamental principle by itself is not reasonable, allocable, or allowable. So what do those three terms really mean? And how do you apply them in real life? So the regulatory citations are provided on the slide for your reference, but let's talk about how these concepts work and how you can use them every day. So when applying OMB cost principles, you're going to want to ask some basic questions. Is it necessary? Is the cost for an eligible activity? Does it meet program standards? Is there a need for the assistance? Then you're going to ask about reasonableness. Is it reasonable? Would a prudent person consider the cost to be payable by the award? Does it fall under one of the other reasonableness factors listed at 2 CFR 200-404? And then you're going to look at, is it allocable? Are the costs in accordance with relative benefits received? So these are the questions you can ask when you're looking and trying to apply the cost principles and looking at DOB. So for any program, grantees can assess the risk for duplication of benefits and determine the net level of necessary oversight or review based on that risk. So that's an important concept, and we're going to come back to that again. So cost principles guard against DOB. Let's look at an example. Think about with rental assistance. Your typical procedures, how typical procedures can promote necessary and reasonable costs and guard against DOB. So consider rental assistance. Rental assistance funds can come from many sources. So you're going to need to be on the lookout for duplication of benefits. So start by asking yourself, how will you assess the amount needed for rent, utility costs, and deposits? What sources are available to pay the costs? Are your procedures even designed to assess funding sources that typical beneficiaries could possibly receive for the same purpose? If beneficiaries receive assistance from several sources, are those funding sources for the same costs or different costs that are part of the same activity? Finally, now that you have all that information, are those costs reasonable based on the type of assistance and income of the beneficiary? Now, I do want to make a note about income for the beneficiary. While the beneficiary's income is not a source of assistance for purposes of calculating DOB, income generally must inform the assessment of how much assistance is reasonable under cost principles. So basically, while the cost principles protect against DOB, and DOB and cost principles are not the same thing. They reinforce each other and they're tools working for the same purpose, but DOB is specific to the person, but necessary and reasonable questions can happen at a program level. So for example, if there's already money from another source to pay for something, you wouldn't pay for it with CDBG-CV. At the same time, necessary and reasonable goes beyond DOB consideration. All right. So let's do poll question number 4. Another true or false. In order to meet, I'm going to pull mine up on Slido over here. There we go. In order to meet all federal requirements, all CDBG-CV expenses must be necessary, reasonable, and allocable. Is that true or false? Let's see those responses coming in. What do you think? Still seeing mostly everyone's answering true, so good. That's good. Great. Oh, yeah, a couple are false. So again, back and repeat. This is a true statement. In order to meet all federal requirements, all CDBG-CV expenses must be necessary, reasonable, and allocable. All right, so basic DOB calculations. We're going to shift gears a little bit and do some math. Great way to start a Friday morning, but this stuff is pretty simple. And I like math anyway. So we're going to start. Simple example. All right, for establishing a DOB strategy and guidelines, grantees and subrecipients should become familiar with the basic steps of performing a DOB analysis. These steps provide the foundation for your operating procedures for preventing duplication of benefits. The first step you're going to need to do is straightforward. Assess the amount of need or the total cost of the activity. So we're going to use this example of a $100,000 cost to rehab a long-term care facility for renovating a floor so it can be used for isolation to care for COVID-19 patients. Then we're going to do step 2. And it's important to determine the amount of assistance. Now, it's important to remember that when evaluating a recipient's needs, that a recipient may have multiple sources of assistance to address those needs. Not all sources may be used for the same cost. So be sure to ask about the recipient's resources and how they plan to apply those resources to specific costs. So in this case, we were looking at the renovation of a single floor for isolation purposes, and you want to make sure that the funding sources, the other funding sources are going to that same purpose. You may find that resources will be applied to separate costs and not present a duplication of benefits. So if it's used for a different purpose, even if it's the same facility, there may not be a duplication of benefits in that case because it's a different purpose. So in the case of our example, we had $100,000 for COVID-19 funds available. And in this case, we have the long-term care facility was awarded a $50,000 grant from HHS Skilled Nursing Relief Fund to prepare for, and respond to coronavirus, and has $10,000 of that amount remaining after paying for the other HHS eligible costs. So they can use that $10,000 for that same renovation. So in this case, cost for activity is $100,000. Other sources, we have $10,000 from HHS fund. You subtract that out to find the difference. So our maximum CDBG award possible would be $90,000. That's considered the unmet need. That maximum award is unmet need. When there's a balance of unsupported costs after applying existing resources, then the CARES Act can be invested without causing a duplication of benefits. The last step of this process is to document steps 1 to 3. If you've incorporated elements of the prevention of DOB in your policies and procedures, then this step should run really smoothly. So remember, duplication of benefits and cost principles are closely related. When you document the cost charged to your CARES Act, according to the standards for financial management at 2 CFR Part 200, you can also use that documentation to document your compliance with DOB. So the idea is you bake it all in. And we're going to talk about that in more detail when we dive into our principles, our policies, and procedures rather. So here's one more example. We have a family seeks emergency rental assistance under an ESG funded homelessness prevention program that provides assistance for up to 6 months. So remember our 4 steps: assess the need, determine other sources that have been or will be used to pay part or all of the costs, calculate the maximum award or the unmet need, and document that analysis for compliance. So we're assessing the need. In this case, we're saying its monthly rent is $800. The monthly utilities, we're going to estimate, just make an estimation here, combining all those utilities together is $200. So the total need for a monthly basis for this family is $1,000, and that's for 6 months that they need. So that's the need, step 1. Step 2 is determine the assistance from other sources for the same cost. In this case, the application asks whether the family is receiving assistance from another source. The family reports that its church, remember we had that church example before about giving them a gift of $100 for no clear purpose? This one's a little more specific this time. So the family reports that its church has pledged to pay its utility bills, which is a specific purpose, in arrears, and do that for the next 3 months. The family certifies it has not applied for assistance from any other source. So the duplicative amount for the same purpose from other sources are the utility payments for 3 months, which are then estimated to be $600, okay? What I want to note too is that phrase, the family certified it has not applied for assistance from other sources. It's important to know that those other sources may be available to recipients, so you should include in your subrogation agreement, and we're going to talk about that, include in your subrogation agreement a requirement for the beneficiary subrecipient to notify you as the provider of those funds if additional resources become available, and that agreement should also be set up in a way that enables you to recapture those funds or to have them pay them back to you if they're no longer needed by the recipients once other resources do become available. All right, so that side note, important. We're estimating our amount. Utility payments are estimated to be $600. So we're going to calculate the maximum monthly award to avoid DOB. So we have months 1 to 3, 1,000 minus 200, it's $800. And that's accounting for that gift, for that total $600 gift, which we're breaking back up into $200 per month, okay, because they're only covering 3 months. So you calculate months 1, 2, 3, 1, 2, and 3 with that award incorporated into that. So their total monthly need is $1,000. For the first 3 months, subtract that $200 per month. So that comes out to be $800 a month just for those first 3 months. Then so that's your remaining unmet need. For months 4 and 6, 4, 5, and 6, there is no additional funding source from another location. So in those cases, that full need of $1,000 is what that applicant is going to need. So in this case, you would have months 1, 2, and 3. Each month, you would be able to pay $800 without a duplication of benefits. For months 4, 5, and 6, you'd be able to cover with CDBG-CV funds $1,000 per month without a duplication of benefits. Okay. So those were our simple math examples. Now we're going to go right into policies and procedures and how to set this up. This process is actually really straightforward, but the challenge is the biggest challenge you're going to have in this whole experience with DOB and preventing DOB is obtaining that information you need to make the calculations and then documenting it. So you really need to make sure you have solid policies and procedures in place to document that you've adequately assessed, accounted for, and responded to any possible duplication of benefits. All right, so let's get started. So to get started, keep in mind that for CDBG-CV, some practical pieces are that CDBG-CV duplication of benefits requirements apply to all CDBG-CV allocations, as well as to the fiscal year 2019 and fiscal year 2020 formula CDBG allocations that were used to prepare for, and respond to coronavirus. So those are just those funds from those 2 annual grants that are going for coronavirus pandemic related purposes. Okay, so at least that's our CDBG-CV duplication of benefits. That's what that applies to. The DOB requirements are the same for states and entitlements. A grantee can reassess that need, whatever that need for the beneficiary is at a later point in time. So we just talked about the example where they said they hadn't applied for additional funding, perhaps they had, and then you would have to reassess to see if they actually received the funding they applied for. And then, so there could also be rent increases or increases in construction costs or other orders. Then we're looking at uniformity in process. This is just some solid guidelines for developing your policies and procedures to keep in mind as you do this. Uniformity in process can support your consistent outcomes. This one's really important. Here is where you want to bake all of your DOB elements into the process steps, wherever it's relevant. So you want to ensure that you have uniformity in how you do things at the program and activity level. So for example, if you're doing a budget, then you want to have all those sources identified. If you're using an intake form for beneficiaries, you want to ask them for their other sources of funding on that form. So that way you're not just treating everybody the same, but you're also gathering that same information at the same time. You're doing yourself a big favor by putting it out there right away and being able to gather that information. So let's think about that, talk about that one a little bit more. Asking about DOB in the application intake process. You can ask, have you received rental assistance from other community organizations in the last 3 months? What resources have you used to pay rent or utilities in the last 3 months? So these are some things you can put into your standard protocols to start gathering that information you need to calculate and establish if there's a duplication of benefits. Document the questions and resources provided by the client. Some other ideas here: confirm or request verification from organizations on amounts and time periods. Have the client sign a statement affirming that they have not received financial assistance for the same period of time from another organization. You can have the client sign a statement that they acknowledge and agree to repay funds if in the event that a duplication of benefits is determined, and have that be a condition of receiving assistance. And you can also include risk-based analysis in your procedures, like service providers who are providing the same target population, or service providers that receive CARES funding from similar activities. All right. So the DOB analysis, remember, is at the level of the activity of beneficiary, not at the program level. So the grantee or subrecipient is like a person who could have a DOB. Finally, in this case, duplication of benefit requirements must be passed down to all subrecipients. And one more thing to keep in mind is a program office may provide more specific information to comply with the program requirements. So that's like our DOB, the CDBG-DR program has more specific requirements than we do. So a quick, so grantees and subrecipients are also subject to duplication of benefits. And I have a brief example here where CDBG-CV funds were supporting the salary of a social service provider who works for a Meals on Wheels program. And the program also receives funding from the HHS Meals for Older Adults program. The grantee can require detailed budget to distinguish which costs are supported by which program to establish if there's a duplication of benefits there. Additional considerations about risk when you're building your policies and procedures. You should consider designing duplication of benefit policies and procedures that are specific to each CDBG-CV program and activity. That could really help you out. Grantees must make reasonable assumptions about risk and necessary documentation. Your policies and procedures for assessing duplication of benefits should be commensurate with the risk of duplication of benefits. For example, if a future assistance is nearly certain but amount is uncertain, then you can assume there may be a higher risk for duplication of benefits because you know there might be more funding coming in. We just don't have that conclusion or confirmation just yet. Your policies and procedures for duplication of benefits should be specific to each CDBG-CV program or activity. Risk assumptions, extent of effort to document absence of DOB should be defensively reasonable. The risk of DOB may inform policy regarding monitoring subrecipients or beneficiaries for DOB after assistance is provided. And now, what actually needs to be in your policies and procedures? And how should you actually implement this with your subrecipients or beneficiaries? So to comply with DOB requirements, grantees are required by the CARES Act to establish are required to establish and follow procedures to ensure that a DOB does not occur. Establishing a process to effectively identify and prevent duplication of benefits is critical for CDBG-CV grantees to effectively manage the multiple active funds related to coronavirus response and effectively targeting CDBG-CV resources to meet unmet needs within the community. So you should establish policies and procedures that incorporate the following components. You want to make sure you have a subrogation agreement. I already mentioned that once, but have a subrogation agreements with requirement to repay that assistance that's determined to be duplicative if that were to occur. So in doing this, it establishes a protocol to monitor compliance based on the risk of DOB as well. Okay, so that's really important. That's what can tie your beneficiaries and make sure that you can get repaid if there's a duplication of benefits. So that you don't actually have to repay your federal grant from other funds. You want to include in your policies and procedure a method of assessing the likelihood of a duplication of benefits by evaluating the need and the resources available. So I have a link here. We've put together, it's about a little more than a year old, but we've put together a list of federal CARES Act and coronavirus response programs and funding sources within the federal government. So you can take a look at that if you're not familiar with some of the other agencies and the funding that they're providing for to address the COVID-19 pandemic. That list will give you some ideas of what you can look at, look for, what you can ask about for some of your bigger projects and activities. And that list, I believe, is also included in the documents attached to this presentation. Now, to ensure policies and procedures accurately reflect the specific components of each program, grantees should consider designing their duplication of benefits policies and procedures that are specific to each CDBG-CV program, supported with CARES Act funding, and commensurate with the risk of duplication of benefits. So I want to give you an example. You have, or general conceptual example. You have an involved or complex program like rental assistance, then the policies and procedures might be more detailed because in those cases, you have a higher risk of DOB. Remember, we used that example earlier. Rental assistance can come from a lot of funding sources. So you have a higher risk that there's going to be a duplication of benefits. If you have a low risk of DOB for something that's a type of activity that's a lot more straightforward and simple and isn't as likely to have funding sources coming from many different areas, your policies and procedures may be more simple for that. And so finally, applicants should consider under the risk of penalty that they understand that they can't have duplication of benefits. All right, so we're getting close. The other part here is you want to look for other funding sources. This can be one of the most challenging parts. We just talked about that with that list, referencing that list of other federal CARES Act funding that you can look at. One of the you want to be proactive and engage with your beneficiaries and subrecipients to gather this information for possible sources. And talking with folks over this week and just in knowing about duplication of benefits, I understand this can be one of the most challenging parts, is identifying where these other funding sources are coming from and figuring out how to do that. You have to be proactive in doing it. One of the ways you can do it, policies and procedures, including your intake forms, we talked about that. You can also use data sharing agreements. Be a little bit more engaged with this. Use data sharing agreements and compare beneficiary lists with other programs that are operating and funding similar activities for similar purposes. You can compare with other programs just within your own agency. And you can also ask applicants for other funds or sources they've received. And we talked about that with the intake form. The overarching principle here is that when you're developing your policies and procedures, HUD standard is that they have to be adequate. The grantee should say, what is adequate, and they need to write it down. And that way, when HUD monitors, you can point out in that document how you establish your policies and procedures to be accurate and complete. And that if you've made that determination, then HUD will be able to clearly at least walk through and see the process that you went through to say, this is how we determined that we didn't have a duplication of benefits and how our policies and procedures were adequate enough to ensure that. We've checked these sources, we've done all these things, and you've written that down, and you can clearly share that with us. And finally, here you can strategize. So when you know one or more sources could be used to pay for an activity, then perhaps you can eliminate potential sources of duplication by eliminating the overlap in planned uses of funds. So you can be creative about that. So if a duplication of benefit is found, what happens? You can always reevaluate the need and document the remaining duplication of benefit. But typically, there's going to be more need than there's money available. And that makes sense to see if the need has increased, or to see if the need has increased, because usually that's the case, is there's more need than funding available. Now, if your reevaluation still shows a duplication of benefits, then you can write a letter to the beneficiary requesting repayment or other collection procedures. And if you have a subrogation agreement in place, then you have a contractual basis to get that money back. Any collected amounts from those beneficiaries to the grantee. So if they had more funding available, you find out and you say, oh, you got a duplication of benefits, you're going to have to repay that $100. Then they pay that $100 back to you appropriately. And that is going to be treated like a return of grant funds or an applicable credit. It's not considered program income. Program income is another item, another subject that can give people heartburn and make people feel very intimidated, just like duplication of benefits does. So please take note of that, that right there. If you do have a duplication of benefits repaid back to you from your beneficiaries, it is treated like a grant funds or applicable credit, not program income, okay? It's like a rebate, it's coming back to you. Now, if your grantee doesn't, your beneficiaries don't pay that back and HUD finds that you have a duplication of benefits, there could be a recapture in that case. And in that case, the grantee is responsible for compliance with grant requirements, and non-compliance would be subject to program remedy. So with the grantee, this is why it's so important that you have that subrogation agreement in place with your beneficiaries, because if you don't have a way for that grantee to repay, then you are going to be on the hook to HUD for non-compliance. Okay, so ultimately, the responsibility falls on the grantee. If you collect DOB from your subrecipients, then there's nothing for HUD that HUD would need to reinforce, because the funds have come back to the purpose intended and not a DOB. Okay, so I'm going to try to speed up here. Our best practices include questions in the application to assess whether other sources are available to pay for the same costs. Ask to verify likely sources of assistance that might be available to pay for the same costs. Include an agreement to repay DOB as a condition of assistance. Develop risk-based DOB procedures and policies. And then finally, adopt policies and procedures to address how the grantee plans to recover duplicative assistance when a DOB is identified so it can avoid non-compliance. I'm going to skip this poll question just because we're running a little bit late here. And we're going to go straight to our special considerations. Okay. So this one, we'll actually move fairly quickly because this is really just giving you that update on the Stafford Act and what changed here. So the Stafford Act was amended by FEMA publishing guidance in February 2019 that basically said that loans are not considered a DOB for years covered by DRRA. So the DRRA is an act that was passed. So what you need to know here is that, popped it back, wrong area. What you need to know here is that this doesn't automatically require the use of federal grant funds to repay loans, depending on the grant program requirements. But what is important to you is that loans are considered differently than permanent assistance when establishing a duplication of benefits. The terms of the loan and the source of the loan are consideration. And generally, a loan, like a subsidized loan, is not a prohibited duplication of benefits, so long as it's used towards the activity. Now, I have on here the link for the FEMA fact sheet for DRAA. This covers the federal disasters that were declared between 2016 and 2021, which includes the coronavirus pandemic. This sunsets in October of 2023, but you probably won't really need to worry about that. But what it does is it changed the effect or changed what loans were to be included in a DOB analysis. That's what you need to know. What loans are included in DOB analysis. So here you can see private loans are never considered a DOB. These are loans that are not provided by a guaranteed or government entity. Subsidized loans, they might be a DOB. It depends. It depends if they're forgivable or where they're coming from. So you'll have to look at that. Decline loans are never DOB. If a person for a beneficiary never signed loan documents, it doesn't exist, it's declined, it's not going to be considered a DOB, and canceled loans are never a DOB as well. Some special notes on DOB here for this is that the short-term loans, like construction loans, must be repaid, may not be a DOB, and this will still continue to apply so long as if DRA sunsets in 2023. The Stafford Act allows federal funds to be used for short-term coverage when primary sources will be available later, subject to agreement to repay. And then I also want you to pay close attention to the eligibility for reimbursement with loans. So these are the main loan ones. Additional special treatment on loans to pull this together. Actually, this is just our example, and I want to take a look. I'm going to hold off on that for a second, see if there's any questions. Not actually seeing any. All right, so we got 3 minutes. I'm going to go through this example very quickly. So loans are treated differently, and that's how the Stafford Act was amended, so that they aren't actually under, it depends on the type of loan to determine whether or not they're DOB. So you can look at those slides and pull that together, and I'm pushing through the end here. So in this case, the example is Shelley Shoemaker. It has a repair shop. It's a for-profit business. It was shut down because of the COVID-19 emergency declaration. Sally's business applied for and received an SBA Paycheck Protection Program loan, and that helped keep staff employed during the crisis. This loan is going to be fully forgiven if the funds are used for payroll costs, interest on mortgage, rent, and utilities. At least 60% of the forgiven amount must also have been used for payroll. And how can CDBG grant you as a CDBG-CV grantee assist Sally without a DOB? So there's no duplication of benefits if the CDBG grantee provides assistance for the cost of CDBG eligible activities that are not one of the eligible uses of PPP loans. So if you're providing assistance that is for payroll, employee health insurance, mortgage insurance, rent, utilities, other things like that, then your CDBG-CV is providing assistance for something else, it wouldn't a different purpose, then that wouldn't be a duplication of benefits. Sally, there's also no DOB if Sally Shoemaker has not received financial assistance for that cost for some other source. There's no DOB if the need remains. So in other words, Sally Shoemaker didn't misuse SBA funds to meet the need, and she still actually has additional need available. So that's one of the ways what you can look at. And finally, if Sally Shoemaker uses the PPP funds for payroll, employee health insurance, mortgage interest, any of these other elements, The CDBG grantee may be able to assist other remaining needs for which Sally has not received any source of assistance, such as perhaps upgrading the shop's HVAC system to reduce the spread of germs, or reconfiguring the building and parking lot to add drive-through window service or for customers to increase social distancing and avoid too much contact. So again, you can look at it, you have to look at the circumstances, but that amendment changed how, oh, there we go. Changed how how we treat loans with considering duplication of benefits. So finally, we have the additional resources. Here's some additional guidance that you can consider. I'm not going to address those right now, but just some additional items you can look at that may be relevant. And I do have one question, although we are at time. It says for 6 months. This is more of a question for I believe, the type of rental assistance. Gloria, do you actually want to take that? Because it seems less of a DOB question.
Sure. I'm presuming you're talking here about emergency grant assistance.
Mhm.
And for the 6 months, and then they decide to request assistance again. What we've determined is that if they've received assistance once with CDBG-CV for the entire 6 months, they cannot request assistance again for the same activity. Even though it's in a different location, it doesn't make any difference. The idea is that this family has already been assisted for up to 6 consecutive months as provided for the notice. Therefore, they can, whether they move or stay in the same place, they cannot apply for the same assistance again later. We don't call it a duplication of benefits. We just, but the answer is they cannot.